Okay, so welcome to the show, Dr. Gabrielle Lyon. I've been really, really looking forward to having you on, and I'm so glad we finally have this moment together for you to share all of your wisdom and experience with the audience.
Yeah, I appreciate it. Thank you.
Yeah, I have a wonderful community, and as we were talking beforehand, I was talking about how I've been following your work for quite some time. I think it's a really unique and a very powerful perspective that needs to be shared. And I know my community is going to embrace this information. So can you talk about muscle-centric medicine and
Yeah.
what got you interested in this?
Yeah. So the concept of muscle-centric medicine is really this idea that skeletal muscle is the largest organ in the body, not skin, but skeletal muscle. And actually it determines everything about the way you age, your metabolism, overall health. And I'm even going to say longevity, which is an incredibly hot topic. I think right now as a society, we're always thinking about obesity. We are always thinking about body fat, when in fact, that's a secondary issue. Skeletal muscle is primary.
Right.
Obesity comes after defects in skeletal muscle. So this concept of muscle-centric medicine really highlights skeletal muscle as the focal point.
Yes, so let's break that down because that's really a conceptual change for a lot of people. You know, we have a society where we're so focused on losing weight, losing weight, losing weight, when the scale isn't really the measurement we should be focused on. And, you know, people will say, oh, your clothes might fit differently, but we're so obsessed with that number on the scale that I actually don't even weigh myself anymore because it can be, you know, kind of traumatizing for people when they see the numbers go up or down, when in fact, at this point in my life, I'm afraid to lose weight because that means I'm losing muscle, losing bone mass, losing getting saggy skin in my face as a result of losing bone mass and that sort of thing. So how do we, can you share why losing fat is not what we should be focusing on and why gaining muscle will take care of everything else?
Well, number one, we've been trying to lose fat for, I don't know, it's got to be, when did the whole weight loss fad start? Last 30, 40, maybe 50 years. We haven't been successful at it. We are so obsessed with adipose tissue, with fat tissue as the focal point. It's a mistake. If it was going to solve a problem, we would have already solved that problem. My argument is that we must shift to looking at skeletal muscle. This idea that we are over fat first is a mistake. We're actually under muscled. Obesity comes along after you have issues with skeletal muscle. And if you are really caring about your body composition, if you're caring about obesity, you have to focus on skeletal muscle first. One of the reasons is, you know, skeletal muscle is your metabolic organ. It's your engine. It's your currency. It relates to nutrient utilization, you know, thinking about carbohydrates, fats, and proteins. The primary site of that, especially, you know, fatty acids and glucose, you're looking at skeletal muscle. The idea that you're going to be constantly losing weight and you should focus on constantly losing weight, you will always, well, number one, you will never lose fat by in and of itself, only fat. Each time you lose fat, you do lose roughly 3% of some kind of lean mass, whether it's collagen, connective tissue, you're going to be losing some kind of lean mass. However, the reality is most people crash diet. And when you crash diet, you are going to be catabolizing a lot more skeletal muscle. And as you age and become more mature, it becomes much more challenging to actually regain that.
Okay, so let's break it down a little more into explaining how muscle is your metabolic currency.
Yeah.
On that. So what kind of role does explain that?
Yeah, well, everybody has heard about carbohydrates. The majority in carbohydrates ultimately become glucose in the bloodstream. The primary site for that uptake is skeletal muscle. So if you are caring about the food that you're eating and the calories you're consuming, then you have to have healthy muscle.
So basically what you're saying is after you eat a meal, and I've had continuous glucose monitors on so I can see quickly the glucose uptakes. So after you eat a meal, how long that glucose is in your bloodstream is primarily dependent on how much muscle you have. And
I think that that's a little bit of a layered question, right? Because the definition of diabetes is having an elevated blood glucose over a 2-hour period, right? Is the amount of glucose that you would utilize directly related to your skeletal muscle mass? Well, it's utilized by a lot of different organs in the body, but skeletal muscle is the disposal site for 80 to 90%.
Okay.
And then if you're exercising, you're going to be disposing more.
Okay. So what do you mean by disposing versus storing?
Utilizing it, getting it out of the bloodstream. Glucose is toxic to the bloodstream.
Right.
Glucose is toxic to cells, period. You don't want to keep it in the bloodstream. You have to mobilize it out.
And we see that with skin over time, especially in diabetics as the extreme, but even in people who have very processed foods, they're form advanced glycation end products and that sort of thing, which makes the skin and the collagen really stiff and causes a lot of coarse wrinkles and stuff. So that's happening to all of the organs in the body. So that's why we want to get the sugar out. Okay, so the uptake into the muscles is dependent on basically how large that organ is, which is
how healthy it is.
How do you make it healthy? Let's talk about how to make your muscles the appropriate size for your body, because
nobody knows that. So this is where the science is really lacking. When you think about it, we know what a body fat percentage is that may cause problems, right? They define a certain percentage. If you're 30% body fat, you may have issues. There's a whole chart, right? Body fat percentage is X. There is not a chart for skeletal muscle mass. We have no idea. I have no idea what your skeletal muscle mass should be in any kind of optimal range.
Yeah, that's fascinating. That's
we really have this backwards. If we truly want to move the needle in health, then we have to adjust our thinking. We have to adjust our thinking. And then two, as providers and as scientists, we have to actually start looking and measuring other things. There is no recommendation for your optimal skeletal muscle mass. How is that possible?
So how do people even start then? What are they?
Right. It's just like this crazy concept that we don't know. How is that even possible? So, I think one of the big questions is, how do you make muscle healthy? Well, there's two ways to stimulate muscle, and that is through resistance training or exercise. Exercise also stimulates muscle, and dietary protein. Two factors that are vital. And you need to do that when you are younger. There's this concept of sarcopenia, which is a decrease in muscle mass, strength, function, right? And then there's diapenia. There's all different forms of diseased or less than optimal muscle mass. Mm-hmm. We have to think about how are we going to address that? And addressing it isn't in your 50s, 60s, 70s, and 80s. It's much more important. I mean, you do have to address it then, but it's much more valuable to address in your 30s, in your 40s, making sure that you are not overweight, making sure that you are prioritizing behaviors that promote muscle, which are resistance training, really optimizing protein intake, not just in a 24-hour period, which ultimately people talk about in the literature. A lot of people say, well, it doesn't matter how you're eating protein, but it actually does. It's pulsatile. When you eat protein in a pulsatile manner, you increase the amino acids in the bloodstream. Amino acids, we know, are building blocks, and there are essential amino acids, which means we must get them from the diet. When you think about creating a diet that is going to help augment healthy skeletal muscle, that nutrition intake is going to be 30 to 50 grams of dietary protein per meal, which is probably double than most of your listeners are doing now, because the focus hasn't been on protein in general in any of the narratives.
Mm-hmm. Yeah. Okay. So that's really good. And I've heard you talk about that on a lot of different platforms regarding the pulsatile amounts of protein, milligram per body weight of protein.
1 gram.
Sorry, and 1 gram of ideal body weight. Mm-hmm. So I want to talk about that and break it down more into a practical sense. And then I do want to get into the exercise and be a little bit more specific to give people some general action plans on where to start, depending on where you are in your life. Like if you're in your, assuming that you're not a competitive athlete and that you're in your 20s, 30s, 40s, 50s, and beyond, men or women, I'm sure the guidelines are a little bit similar, but with some nuances. Where do they start from a practical perspective as far as If someone's doing, I'm not going to talk about OMAD or 1 meal a day because I can't imagine
You can,
eating,
but it's not ideal.
right? Let's
Yeah.
just imagine someone's doing intermittent fasting or time
Okay.
restricting.
Which is super common.
Very, very common nowadays, 2 meals a day, not grazing, or let's talk about grazing. Is grazing something that people should do, or is it harmful? So let's
Yeah.
talk.
So typically when my patients come to me, one of the things that I think about and we assess is what is their ideal body weight? And let's say an individual's ideal body weight is 130,
And
130 pounds.
how should one figure that out?
That's a great question. We don't actually know that now, do we? But people typically have a sense. They'll tell me one of two things. I want to look a certain way, and this is the weight that I felt my best. We all have kind of a sense. And if this isn't about precision, right? It is about perspective. And if an individual feels best or they believe that their ideal body weight while being lean and fit is 125 or 130 pounds, I typically recommend that individuals start with that amount of protein.
Okay.
Then you divide that into hitting ranges between 30 and 50 grams per meal.
Okay. So someone is 130 and they're having 2 meals a day. I mean, that's a lot of protein per meal. You're saying they should probably.
That's not ideal. 2 meals. So you have to determine what is the goal. If your goal is to lose weight and your goal is metabolic correction, your goal is to improve glucose regulation, right? And improve blood sugar regulation, then you're looking at 3 meals a day.
Okay.
An individual who is really wanting to just at baseline begin to lose weight, that is 30 grams of protein, which is anywhere between 4.5, 5 ounces of protein 3 times a day.
Okay. And is there a minimum amount of protein that somebody needs to be taking?
I wouldn't go. The minimum is defined as the RDA, which is 0.8 grams per kilogram. That's the minimum to not have any kind of issues, like it's disease.
No,
Keeps you out of the disease zone.
Minimum per meal, like minimum per meal to stimulate.
Yeah, you need a minimum of 30 grams per meal to stimulate muscle protein synthesis. Anything below 30 grams protein per meal, it's still beneficial, right? Protein is a beneficial macronutrient in many, many domains. But in terms of muscle health, you really want to get a minimum of 30 grams. It's interesting. Skeletal muscle is an organ system, and it's an organ, and we often think about it as it relates to locomotion and movement. But skeletal muscle is a nutrient sensor. It requires a certain threshold of amino acids, in particular leucine, which is one of the essential amino acids, to even begin to recognize that protein, because it's not about the protein, it's about the subsequent stimulation for muscle protein synthesis, for laying down new tissue, for protein turnover, which is extremely energy expensive for the body. Okay. If you are aging, if you are overweight, if you are in your 30s, my recommendation is you definitely begin with 30 grams of protein at the bare minimum 3 times a day. And again, one of the reasons is because this will help diminish hunger. And you are going to stimulate muscle throughout the day. While calories are controlled, you still have to control for calories, no matter what you're hearing in the media. Calories matter. Mm-hmm. And then the next step after that would be to then calculate your carbohydrate needs. And carbohydrates are easy. You could start with 90 grams of carbohydrates. The current American is eating 300 grams of carbohydrates. Mm-hmm. The recommended dietary allowance is maybe 130 grams. But start with 90. Anything else above that you earn through exercise. And I'm going to give you one more tip. You really don't want to go above 40 grams per meal of carbohydrates because you get too much of an insulin response. Okay. And we want to make sure we don't do that.
Yeah, no, absolutely. Do you feel like you need to have some carbs with your protein in order to push it into the muscles?
Absolutely not.
Because I think a lot of people believe that. And I personally don't do well with carbs.
No. where carbohydrates are not bad. Carbohydrates are not the enemy. It's not a big deal. However, if you want to utilize carbohydrates post-training for glycogen repletion, perfectly suitable. Perfectly suitable. Doesn't push anything into the muscle. The amino acids in and of itself stimulate muscle protein synthesis. You know, protein does create a phase 1 insulin response in the body. So it is insulinogenic, very slightly.
Mhm.
Meaning you don't necessarily need carbohydrates. Your body can generate all the carbohydrates it needs. For every 100 grams of protein you eat, you generate 60 grams of carbohydrates.
That's really important for people to hear.
60 grams of glucose. Hey, but that's not saying that it's not valuable to have carbohydrates. Now you're talking about nutrient density. There's nutrient density in protein sources, but there are also phytochemicals that I believe that are important. There's anthocyanins, there's other things that are important that come in the form of carbohydrates. Again, we shouldn't villainize foods, but if we are really looking to optimize body composition, the way in which you do that is you prioritize protein, you create a protein forward meal plan for yourself. And then if you want to add in carbohydrates, you're very deliberate. You're very deliberate about the dose of when you're having it. You're very deliberate about, are you eating it with protein? I used to run a weight loss clinic when I was in my fellowship at WashU. And one of the dietary interventions that they talked a lot about was a 1-to-1 ratio of protein to carbohydrates. So if you're going to ingest 30 grams of protein, perfectly suitable to have 30 grams of carbohydrates.
Okay. So you still believe that?
I believe that everybody is different.
Mhm.
I also believe that there are some good scientific fundamental starting places.
Yeah. I only ask that because a lot of what I learned at Cornell undergrad nutrition is completely irrelevant now. So the science changes, you can see, you know, what you're doing, and as new information arises, like we're changing our perspective. And we realize that nothing's absolute, right? That's really the biggest change, is that, you know, there's no absolutes here, and we're all just doing our best with the information that we have at this moment in time.
Yeah, it's definitely evolving. And that's why having a really good mentor or a colleague group is incredibly beneficial, because you learn from each other.
Absolutely. Yeah. Right. We all have different
Mhm.
clinical experiences. And, you know, I teach a lot of courses, and I always tell people, like, you're going to learn information today, but you're going to learn more from your patients, because that's really where we learn the most, you know, from
Uh-huh.
other experiences and their feedback over time.
Yeah.
Okay. So when you're talking about protein, can you differentiate between animal protein versus non-animal protein, and the implications of that?
Yeah,
And
of course.
is it affected? Yeah.
You know, when we think about protein, the first thing that we have to think about is protein quality. Protein quality is defined by amino acids. The definition of protein quality is really looking at essential amino acids. Those essential amino acids, and in particular, the ones that I'm interested in are the branch chain amino acids, leucine, isoleucine, and valine. And when you think about deciding on what kind of proteins contain the highest amount of essential amino acids, you think about animal-based proteins. And when I say animal-based, can that be red meat? Could it be turkey? Could it be chicken? Yes. It can also be whey protein. It can also be eggs. It can also be fish. These are all sources of high quality protein. And remember, quality of protein is determined by the amino acids. Plant proteins are notoriously low in the essential amino acids, in particular branch chain amino acids, and they are devoid in certain amino acids in general. Very, very low in methionine, for example. Plant proteins are not bad, so I just want to clear that up. But if you are looking at optimizing body composition and you are more mature in age, then animal-based proteins are much more effective. What does that mean? That means I always give this example of quinoa. It takes 7 cups of quinoa to equal a small chicken breast. Because again, if you understand that skeletal muscle is an organ system, and you understand that it requires a threshold of amino acids, particularly leucine, which is an essential amino acid, which goes back to our earlier conversation that you need 30 grams at minimum to stimulate it, here's your choice. You can eat 3 ounces of chicken breast, or you can devastate your carbohydrate intake by eating 7 cups of quinoa. Because remember, we have to meet that amino acid threshold. So there is a huge difference between quality of protein. Now, the next question people are going to ask you is, well, can I be vegan or vegetarian and still get quality protein? You can, but you do need to augment that protein, whether it's with an essential amino acid blend or a branched chain blend. And you just have to be very careful about that carbohydrate intake.
Okay, so let's talk about how to supplement. I mean, where do branched chain amino acids come into play? Like, what do they contain? What don't they contain that like a real piece of meat contains, you know?
Yeah. Well, the branched chain amino acids, so for example, if you have a piece of fish and you have 3 ounces of fish, fish actually has less protein than some of our gravity bearing friends. Gravity bearing friends would be beef or chicken. It actually has 5 grams of protein per 1 ounce. So let's say you're going to eat 3 ounces of fish. That's 15 grams of protein. This would be a perfect place to add in another scoop of branched chain amino acids, because the fish in and of itself have all the amino acids. By adding in another scoop of branched chain, you now bring that amino acid threshold up to look as if it was 30 grams of protein.
Okay, so how does it translate? I should check my cabinet for what I have for BCAAs, but
any kind of, so it would be a 2 to 1 to 1 ratio of leucine, isoleucine, and valine. You're looking for at least 2.5 grams of leucine at a minimum to be what you need to stimulate.
Okay, that's
muscle.
real information. Oh, I mean, information. We don't want information. Okay, that's good. 2.5 grams. So you can do that to supplement. And then when you're talking about 30 grams of protein, I mean, I know there's apps like MyFitnessPal and things like that where you could put it in, but
or Chronometer is even better, actually.
What is it called?
It's called Chronometer. It's even better. It's amazing.
CHRON?
CRONO, Chrono. And they actually look at nutrients as well.
Oh, beautiful. And we're looking at like what, 5 ounces of a piece of chicken, for instance?
So 5 ounces. So so that would be 35 grams of protein. Yeah.
Okay. So that's it. That's I don't think that's very hard to do, at least for my taste.
And that's at the lower end, right? We have to become accustomed to, and listen, if you wanted to increase your protein intake, as we age, it becomes much more difficult to maintain skeletal muscle. It's just the way that it goes. I like 30, 35 grams as a minimum. If you are really looking to optimize body composition, you're going to go higher than that. There's no benefit to going to above 50 grams, but if you can hit it, if you can hit 50, that's great. And let's say you get 2 meals a day where you're getting 50 grams and then 1 smaller meal, you'd be doing just fine.
And then you want to supplement. What I'm hearing from you is that you want to supplement the branched chain amino acids with your meal, not separate from your meal.
You shouldn't be taking branched chains on an empty stomach alone. The one benefit would be that it would help with, you would no longer be very catabolic, right? Because you are now, it does have some protective effects, but no, you should not be supplementing branched chain amino acids alone. But then again, you have to think about what your goal is. Anecdotally, I can tell you that people will take it alone post-workout and they're less sore.
Okay. But if you could take it with a meal, it's even probably going to
only if the meal is low in protein. If the meal is sub 30 grams of protein, then you should take it. If you're looking to optimize body composition. But for me, I don't routinely take any branched chain amino acids because I eat a diet that's high in protein, so I don't need it.
I personally enjoy chewing.
I do too.
So it's so funny that you say, it's not funny. It's very true, but I don't think we notice these things as far as losing muscle mass over time. So a lot of times, like especially people like me, I've always had very thick muscular legs and I've always wanted like those thin, lean legs. And now at my age, like I have a hard time keeping muscle on my legs. And I joke for years now, for maybe 10 years, I would joke in the office because we've gotten so good in the aesthetic world of helping people with their face and their neck and their hands. And I say, well, I could always tell the age of someone by the flatness of their butt.
Oh, yeah.
We really have a hard time keeping that muscle on. And it not only is aesthetically pleasing, but, you mentioned longevity. So how does muscle play a role in longevity? I mean, besides what I consider the obvious, if you have strong muscle and you can get up, from the ground without using your hands, that's a sign of, a good sign of longevity. Having strength and being less likely to fall and crack something when you're older is pretty obvious. But I mean, what are some of the other things that show that muscle is so essential and the largest, most important organ when it comes to longevity?
Well, this is a very hot topic.
Well, I'm a little excited about it, if you can tell.
Yeah. And I think we should really take a step back and preface this by saying living longer, this concept of longevity, doesn't necessarily mean that you're living healthier. I mean, when I worked in the nursing home, those people were living long. You're talking 100 years old. Their lives were hell for them at that point. Longevity, I think, is the wrong endpoint that we're looking at. I think we have to change the word. And I know I've heard the word health span. I don't know what the new word is. I don't think that we've really nailed it yet. You want to live a life where you can manage your activities of daily living, where you can go to the grocery store, where you can drive a car, where you can be strong, where you're not bedridden. All those things are incredibly important, right? This concept of longevity, which you will hear a lot in the plant-based space, is, protein. You shouldn't eat protein because it affects longevity. And my argument would be, okay, let's say if you were vegetarian, you're going to live to 97. And if you're eating protein, you're going to live to 96 and a half. Right? So these are the kind of conversations that people are having, that longevity is, people should shy away from red meat because they want to live longer. This is all not true. And the whole perspective is wrong. When you think about living healthy and living to an older age, you have to think about capacity. And we know that the more skeletal muscle mass you have, the higher your survivability, the lower your morbidity and mortality are. The more muscle mass you have, the better your capacity to survive anything, including cancer, is.
It's not a bell-shaped curve. It just keeps correlating up. I mean, there's got to be a point where too much muscle mass isn't healthy.
We haven't seen that. Show me a study. Never seen it.
Yeah, no, neither have I.
Never seen it.
And it's just so natural for us to lose. I see a lot of guys in the gym, obviously, that are doing, exogenous testosterone that are a little on the large side. But, in 20 years, I don't know where they're going to be. I just don't know. So it's kind of interesting that you say.
You're talking, but that's different. Now you're talking about anabolic steroid abuse. Yeah. Abuse and super physiological levels are totally different than, optimizing for some testosterone level.
Mm-hmm. Naturally is what we're talking about
here. Yeah. Or supplementing. I use a hormone replacement all the time in my clinic, but it doesn't mean that I'm pushing them to dangerous levels or super physiological zones.
Mm-hmm. Mm-hmm. Okay. So,
and that goes the same for women. Women lose testosterone as they age as well.
Mm-hmm. Yeah. And we need it. We just have different.
Yeah, of course. But in different proportions. Unless you want chin hair, then go right ahead. Or a mustache.
And acne. So you kind of touched on the role of mTOR, right? Yep. And there's a lot of controversy of mTOR. And it's interesting to me how, this world of health, we like to villainize or make certain things the heroes or the villains, where in fact, everything plays a role and everything's important. Mm-hmm. And even on a recent podcast I had with naturopath, Dr. Julie Greenberg, she talked about mTOR's role in acne. And yes, it plays a role in excess sebum and excess keratinocyte proliferation and acne formation. But I think what we're villainizing is actually the chronic elevation of mTOR and not what I hear you describing as this pulsatile increase in protein, which may raise mTOR just like carbs and
No,
working.
it does. It absolutely does. But also, you said it right. So let's frame the conversation. The conversation that people are having is that stimulating a biological pathway in the body is bad. Stimulating a biological pathway that has been maintained for our lifespan, our not even generations, every human, for our species.
Mm-hmm. And others.
And on other species, every other species as well. So mTOR is this growth pathway, and it's mechanistic target of rapamycin. Okay. There's complex 1 and complex 2. Complex 1, which is the one that is villainized, is in every cell in the body. Every cell in the body. There are multiple things that it does. And the most important thing is that it is a growth promoter. Okay. It is stimulated by energy. It is the meaning coming in calories. It's stimulated by mechanical load, exercise. It's also stimulated by protein, stimulated by certain amino acids, more so some than others, also carbohydrates, also stress. And the conversation that everybody's having is that you should dampen mTOR because of a risk of cancer. What is anybody talking about? And what kind of cancer are we talking about? You're talking about lung cancer that we haven't gotten better at treating in the last 60 years? Are you talking about breast cancer? Or are you talking about colorectal cancer? Cancers like this are diseases of the genome. And we know adiposity is oncogenic, right? Adiposity is a risk factor for cancer. And the argument is that we should dampen mTOR by not eating protein. You don't hear anybody else talking about carbohydrates, that maybe we should reduce our calories because our calorie consumption is causing cancer because we are overeating. Tell me this doesn't blow your mind. People are saying, don't eat protein because protein stimulates mTOR. That is the same as saying, don't exercise because exercise stimulates mTOR. mTOR is in this protein complex is in every cell in the body. It's in the brain, the pancreas, the liver. When mTOR is stimulated in the muscle, it is exquisitely sensitive to amino acids, in particular leucine. The idea that eating protein and then a subsequent cancer is going to happen is ridiculous, and it's not proven. I mean, it's like outrageous. I think the real conversation is that people don't want to be eating protein because protein has a face. And that's a real conversation. That's the conversation under the conversation under the conversation. So
I feel like everything, I mean, just to simplify it, everything in this world is really cyclical, right? I mean, women's cycle, the moon cycles.
Yeah.
And we also have to cycle between anabolic and catabolic in our bodies. And that's why all of these processes have a role.
And they're all going on, right? There's constantly protein turnover. It's a thing that's constantly happening. Mm-hmm. It doesn't necessarily turn on and turn off. It's just this thing that is constantly turning over.
Yeah. I want to go back to your comment though about protein having a face, because I mean, I love nature, I love animals, and I also love the food chain. So I have a lot of friends who are hunters. I've been known to trade Botox for elk many times over. And I don't think of it as cruel. I mean, it's sacred and animals are beautiful. And I'm sure there's going to be people who are mad at me talking about this right now, but that's my belief. I don't believe you have to believe what I believe.
Right.
I believe, like, I'm grateful for the animals that I eat, for, what they do for my body, and I think part of that gratitude also helps nourish from the, on the inside. But I mean, let's talk about the, having a face and stuff, because I want to talk about the environmental repercussions a little bit of eating animals. think there's some misinformation out there. And I have heard you in the past speak about this topic, and you do so very, very well. And maybe making people think a little bit differently about this, and opening some eyes and having some aha moments on this.
Yeah. The concept of environmentalism and protein, if we actually look at the data and you look at the EPA, the Environmental Protection Agency, you will see that 80% of greenhouse gas comes from electricity, transportation, and industry. That's where it's coming from.
It's not
no, not animals, which I don't know why no one is. If you really care about the environment, then you have to care about the issues of flying in a plane, driving your car, using electricity. That is 80% of the impact. I'm not making this up, and it's out there, right?
Yeah.
This is what the data suggests. Agriculture as a whole is roughly 9%. Of that 9%, maybe 3.5% is cattle. You remember, you also do have to provide high quality animal-based proteins. You have to provide high quality proteins to children. It's a luxury to say that we're going to reduce our high quality protein intake. There's millions and millions of people that don't even have access to that kind of food.
Mm-hmm.
If you care about the environment, then you have to take a look at the narrative, which is large. It's just untrue. It's just another way of people not wanting to eat animals. That's the reality of it.
Right. Well, and I understand that, conventionally raised animals, that's not humane, and for those of us that can afford to or choose to put their dollars,
And I'd love to say something about conventionally raised animals. Mistreated animals don't grow. Unhappy animals don't grow. This idea that all conventionally raised animals that we hear are treated badly it's not true. I'm sure there are bad practices, because there's bad practices in every industry, in the medical field too, whatever it is. And whether someone is eating organic, if you can afford to eat it, great, but it shouldn't be a barrier to entry.
Absolutely.
And listen, it doesn't mean that we have all the answers. It's not necessarily black and white. I think that this is a conversation that is very important to be had. And I'm sure that there's a solution. I obviously don't know what that is. I don't think any of us know what that is. But I do think that if we begin to talk about environmental responsibilities, that if you live in Florida, maybe you should, I don't know if kale grows there, or if you live in, I don't know, Alaska, you probably shouldn't be eating an avocado, because that avocado has been flown in from God knows where.
Yeah.
Right. There are other impacts.
Right. Okay. Well, I think I love your perspective and how you're not absolute, and you give people good information to head them in the right direction. So I feel like we've covered protein really well. I do want to touch on collagen, and then I want to jump into the role of weight-bearing exercise to give people a guideline of kind of where to start, because I know some people are very aversive to doing weights and to run every day, and how all of those different types of exercise stimulate muscle differently. But can you just talk about collagen and the role collagen plays?
Yeah, I actually love collagen, but collagen is an incomplete protein. It's devoid of tryptophan. It's very, very low in the branched chain amino acids. Don't count collagen towards your protein intake, but it doesn't mean that it's worthless. I don't think that we've seen great data on what it does other than how it affects skin. I mean, as a dermatologist, I'm sure you've seen good data in terms of skin.
We've seen reduction in fine lines and wrinkles, and increased hydration and improved barrier for the skin. So it's great during this time of year when it's cold outside, and we don't see any harm from it. So we do a deep dive with collagen a couple episodes ago. And I think that's important to note. What you just said is that it's great.
Mhm.
but it's not a complete protein, so it doesn't count towards your total protein.
Right. But yeah, that's absolutely right. And it's not dangerous, although you shouldn't be just having that alone.
Mhm.
Um, and then you had another question other than collagen?
Yeah, no, so I wanted to cover collagen while we were
Okay.
talking food, and then I wanted to jump into exercise. So
Mhm.
someone wants to build muscle, enhance muscle,
Mhm.
what's their, ideal world would be both exercise and diet.
You need both. You're not going to, you need both. You need energy. And sorry if you can hear my baby screaming, but you need energy. You need enough muscle stimulation. You need recovery. So there's a whole slew of things that happen, right? Like ribosomal biogenesis and all this other stuff. But ultimately, building muscle requires effort. And when we think about effort, we think about volume. It doesn't mean you need to be lifting heavy. I personally love lifting heavy. I think it's important, but the data actually doesn't support that you have to be lifting heavy, but you do need to go to a certain amount of fatigue, right? There has to be a perceived exertion. You do have to train hard, even if it's with 15 pounds.
So is there a certain number of days a week that somebody should be lifting weights to build muscle versus to maintain muscle as a general guideline? I know
I
everybody.
think, yeah. And this is a bit complicated because there is difference in training age as well as chronological age. There are all different things that play a role in this. Number one, it's much easier to maintain than it is to actually put on muscle. And this comes down to volume and really hitting your muscle groups. I mean, for me personally, I train legs 3 days a week, but it really ultimately is about volume.
That's
Should someone start? Yeah, it's a lot. Someone should, my professional opinion, what I recommend all my patients do is they're lifting a minimum of 3 days a week.
Okay.
But again, this is complicated because if you are training really heavy, maybe you're not going to lift 3 days a week. But 3 to 4 days a week is a great place to start because it is ultimately about volume.
Okay. And then, so just say you're in your 20s, you're weight training 3 days a week, doing cardio a couple days a week, maybe some other fun activities. What does a normal day look like as far as, doing the little teeny things that can help build muscle? Are you encouraging people or advocating to lift with food already on board that day, or while you're in a fasted state and then eating soon thereafter? What's the best?
This is a very interesting conversation. And this is new stuff that I actually haven't spoken too much about. I want to answer your question first about the youth. They have a much easier time building muscle in some regard because hormones are higher and they are driven more by insulin. They actually can get away with less protein. I mean, you've all seen it. You see like the footballer on the Twinkie diet. So there's that component. So individuals that are young get away with a lot less protein, which is crazy when you think about it. What does it look like for training? Obviously, you have to create enough volume where you're doing muscle damage. And this goes across whatever the individual's age is. And then there has to be a component of recovery. And then there has to be a component of enough energy, enough calories.
Okay, so what does that look like in chronology?
It depends. It 100% depends. So if an individual is what?
So you're not saying someone has to eat within an hour after their training or anything?
Not when you're younger, no. When you're older, you better believe you should be.
Okay, so how would it work?
When you're young, when you're in your 20s, you're driven by hormones, you're driven by insulin. You can, get away with doing whatever.
Okay, and
as you get older, right? And then, it's about the 24-hour carbohydrate and protein intake. But actually, as you get older, something happens to the muscle, which is kind of what we were alluding to before. And it's this concept of anabolic resistance, where actually the efficiency of protein use goes down as you age. mTOR the nutrient sensing capacity of mTOR, the efficiency of it goes down. Skeletal muscle becomes more insulin resistant as we age, which stinks. We have to overcome that by resistance training and then having protein arguably quickly after. Can I give you a number? No, but some of the science will show right after training. You don't have to be crazy about it. If it's in 30 minutes, it's fine, but the muscle is primed. And what happens is it is synergistic. Resistance training plus dietary protein becomes very synergistic as we age and can help older muscle respond as if it was younger muscle.
Okay, that's great. Are there any?
And that's much different than the young. And when I say young, I mean like 20s.
Yeah. Okay. And I personally noticed these changes over time. I could lift 10 pounds when I was in my 20s and I would build muscle. And now
and all of a sudden you were jacked and tan, just like that. Exactly. I knew it.
For those of you who want to give me a hard time, but I was very, very tan. So, okay. So as far as any other things that somebody can do, there becomes an age where maybe you need some hormone supplementation. You mentioned
much later. Yeah. And not everybody, right? My dad's 70.
Yeah.
Guy has a testosterone of a 30-year-old.
Right. And I've seen that as well. Are there any supplements? Are there any peptides, anything like that you've used in some of your?
Yeah. CJC and ipamorelin is good. It's a growth hormone analog. There's a lot of things. MK677 is beneficial, can cause a ton of water retention. It's a ghrelin agonist. Testosterone.
Okay.
Works great.
Supplements you like?
I don't believe that supplements make a huge impact in testosterone. You have to have enough zinc, you have to have enough boron, you have to have enough nutrients, but you're not going to take a supplement and it's going to have as robust of a response as actually taking a hormone. However, there are some adaptogenic herbs that I think are great, like Jualalong.
Okay.
I think that works great. The other thing is you want to mitigate cortisol.
Yeah, that's what I was going to say with the adaptogenic herbs, with how, handling stress and your cortisol levels, which basically is your body to get bound up. Okay. That's really, really good information. Okay. So I know you have a hard stop in just a few minutes here, but I wanted to ask, is there any other, anything else that you wanted to share with the audience? Anything on the cutting edge that you want to get out there?
Well, I think that we're going to start seeing some very interesting shifts. And again, this is probably a decade too early. But if you believe that skeletal muscle is an endocrine organ, which it is, then it must release things, which it does. It releases proteins, peptides called myokines, in particular, interleukin 6, interleukin 15. We don't have a good way of measuring it as it relates to clinical significance. And this is some of the work that I'm doing. I believe that this is the way of the future. Right now, the way in which we look at blood work is in the fasted state, which is totally not helpful. In the fasted untrained state, which again is not helpful. I think as science progresses, at least in my clinic and what we're doing and the data that we're pulling, is we are putting together protocols to look at these myokines post-exercise as a way of identifying, is this exercise prescription working? And I think that that's going to be the way of the future.
That's really exciting. I love that. And I love how you pointed out that the way we're testing now, we're so absolute with the answers, right?
It's so ridiculous.
Yeah, it's like
I don't care what my cholesterol is fasted. I want to see how I manage cholesterol post-feeding.
Yeah.
I don't want to know. Why do I care about a fasted challenge?
Right.
And, so these are all the things.
Yeah. And it's this one moment in time. And I always equate it to like looking at a movie and you see a man walking into a grocery store. That doesn't tell you anything about what the movie was about. It was like this one moment that was completely irrelevant, right? That's super exciting work. So do you work with people outside of your clinic, like remotely?
All my patients are remote now. So I see patients all over the world.
How do people find you? And how do you do that? Through your license, or you?
I'm licensed in multiple. It depends. I work with a lot of physicians. So if I have a patient in Dubai, I'll work with their physician, or if I'm licensed in multiple states in the US, but if I have a patient that is outside of a licensed zone, I usually work with their physician.
Okay. And you have a book you're working on,
I
correct?
do. Yeah. You broke up. I didn't hear that last part, but yes,
Okay.
it's good. It's good. Today's a writing day.
Okay, great. So we'll look for that. Do you have a title yet?
I do, but I can't share that.
Okay, well, we'll look for it. Just, what I recommend you all do is we'll have Dr. Gabrielle Lyon's information in the show notes. Go ahead and connect with her, get her newsletter. I find it very informative. I like to nerd out on all the articles. And you'll find out when the book comes. And what other passion projects?
The book will be, I mean, that's the main project, is the book, and then building out the Institute for Muscle-centric Medicine, which I'm building out now, which is where these protocols will come from. And I'll be mentoring and training up other physicians as I step out of seeing and being involved in patient care as much as I am right now in the next year. But I've begun to train other physicians.
Oh, that's great. Okay, and we do have quite a few physician listeners. So if someone was interested in career, they can reach out as well.
Yep.
Wonderful. Thank you so much.
Yeah, you bet.
Love your work.
Thank you. Thanks.
Thanks.